So the important thing to say is that there are two common types of ear infections. The first is an ear canal skin infection, what we call otitis externa. That can be related to using cotton buds or sometimes wax buildup, but quite often going swimming and having a lot of water entering the ear, particularly when people go abroad in the summer holidays. Usually the treatment for that is cleaning the ear with particular microsuction, so in the clinic under the microscope clearing any debris, and often using some antibiotic eardrops with a little bit of steroid as well, and that typically resolves quite quickly. The alternative is a middle ear infection, which happens behind the eardrum. On average, that's younger children who are affected, quite often with upper respiratory infections, typical coughs and colds, where the infection starts in the nose and the throat and can spread up and involve the ears. Treatment often is self-resolving. Sometimes children require antibiotics in order to help. Risk factors for outer ear infections are usually related to lots of water going in the ear, lots of swimming, swimming on holiday regularly, sometimes putting things in the ears, and sometimes even things like shampoo, which might be an irritant. In terms of the middle ear infections for younger children behind the eardrum, that's most often coughs and colds, although sometimes these ear infections can just be spontaneous and even happen very regularly. So outer ear infections are not necessarily completely avoidable, but there are some easy ways to try and reduce the risk. To start with, having ears cleaned and make sure there's no huge buildup of wax. Generally avoiding cotton buds, because cotton buds, although we think they clean the ear, often they cause micro scratches in the skin and the oils of the ear canal and actually predispose to ear infections. Sometimes we recommend something called Earol spray. That's E-A-R-O-L spray. It's like an olive oil ear spray, which can help replace the normal oils of the skin. Some people will then use swim plugs and a swim cap or a swim band to then try and keep the ears dry if they're swimming a lot. Some people will even go to extensive using hair dryers in the evening after swimming to try and dry the ears. In terms of the ear infections behind the eardrum, that's far more difficult generally to prevent. It's often happening at a younger age and related to viruses, which, as we all know, are really very difficult to avoid. For some children suffering lots of infections, we will sometimes use prophylactic antibiotics, so at a very low dose for a couple of months to try and prevent those, and that can be quite successful. So outer ear infections, the most effective thing is to clean the ear and use antibiotic ear drops. For most people, that resolves the problem quickly. For middle ear infections, often with coughs and colds, often it will self-resolve. Typically, though, if the symptoms are persisting for a few days without improvement or the children becoming more unwell, then we would usually be using oral antibiotics. The one difference would be if that middle ear infection bursts through the eardrum and starts to leak pus down the ear, then actually we will then often use a particular type of antibiotic eardrop, which targets that ear space very effectively and can work really well. So thankfully, these are really few and far between, given that ear infections are very common. For an outer ear infection, I would say if it's particularly painful or if it's starting to spread infection onto the skin of the ear or even onto the skin of the face, becoming red, or the person feels generally unwell, then they should certainly seek advice from their GP, ENT surgeon, or if really unwell, then consider 111 or going to A&E. For a middle ear infection, again, they often resolve. Typically, children will respond to oral antibiotics. However, if the pain was becoming very severe, or the child was becoming very unwell generally, or there's any alteration in their behavior, or they were becoming more floppy or a little less responsive, then at that point, again, I would seek urgent help.